Hello teacher, I'm Natalie Ventura Torres. I'm going to talk about Hyperimmune Globulin to prevent congenital cytomegalovirus. My accounts are these. Check them because I will upload update content of medicine. Let's start. First, the definition. Congenital infection with human cytomegalovirus is a major cause of morbidity and mortality. Primary cytomegalovirus infection that develops in a woman during pregnancy confers the highest risk of congenital infection and disease. A study showed that when cytomegalovirus-specific hyperimmune globulin was administered to pregnant women with primary infection, the rate of mother-to-fetus transmission decreased significantly, from 40% to 16%. The dose administration was 100 U per kilogram of body weight administered intravenously. Pregnant women received hyperimmune globulin or placebo every 4 weeks until 36 weeks of gestation. Detection of cytomegalovirus in the amniotic fluid or spontaneous termination of the pregnancy.
The most common congenital viral infection. About 1% of pregnant women acquire the infection for the first time during pregnancy. And about 1 out of every 150 babies are born with congenital CMV infection. CMV is asymptomatic in 90% of cases. However, the main risk is that the virus may be transmitted from the mother to the fetus, causing a congenital CMV infection. This risk depends markedly on whether it is a primary or non-primary infection. In primary infection, the risk is 40% chance that the virus will pass from the mother to the fetus. However, in non-primary infection, the risk of fetal infection is only 1%. But how can we differentiate?
Applications in medicine. This study didn't show a significant reduction in the rate of transmission of cytomegalovirus infection among women receiving hyperimmune globulin as compared with women receiving placebo. Moreover, showed no effect of hyperimmune globulin on the activity of neutralizing antibodies. Similarly, hyperimmune globulin didn't significantly modify maternal levels of DNA in the blood or the time to clearance of DNA from the blood, nor did it significantly modify DNA levels in placentas.
Hyperimmune globulin is similar to intravenous immunoglobulin (IVIG), except that it is prepared from the plasma of donors with high titers of antibody against a specific organism or antigen. Some agents against which hyperimmune globulins are available include hepatitis B, rabies, tetanus toxin, varicella zoster, etc. Administration of hyperimmune globulin provides passive immunity to the patient against an agent. This is in contrast to vaccines that provide active immunity. However, vaccines take much longer to achieve that purpose, while hyperimmune globulin provides instant passive, short-lived immunity. Hyperimmune globulin may have serious side effects, thus usage is taken very seriously. Treatment with hyperimmune globulin in mothers with primary cytomegalovirus (CMV) infection has not been found to significantly decrease the risk of congenital cytomegalovirus infection.
Pros and cons. Pros. No significant difference with respect to sex, weight, gestational age at birth, or Apgar score were observed between newborns whose mother had received hyperimmune globulin and newborns whose mother had received placebo. 6 of 7 premature babies born to mothers who had received hyperimmune globulin were not infected with cytomegalovirus.
Hyperimmune globulin might prevent congenital infection of CMV are a couple. First, there's a long history of hyperimmune globulins potentially stopping infections during pregnancy. The second is there were prior data done in Europe that suggested that there might be some benefit of administration of hyperimmune globulin to prevent congenital CMV.
Cons. The serious adverse events in the hyperimmune globulin group were preterm delivery, intrauterine growth restriction, and induction of preterm delivery. The serious adverse events in the placebo group were spontaneous abortion after mechanocentesis, arthralgia of the upper and lower limbs, and pregnancy-induced hypertension.
Yes, the trial was stopped early at enrollment of 399 patients because the Data Safety Monitoring Board felt that the likelihood of showing benefit was so low that there was not any potential benefit of continuing the trial at that point. What we found, unfortunately, is that CMV hyperimmune globulin did not decrease the rates of congenital infection or fetal death among women with primary CMV infection during pregnancy. We also found that it did not decrease the risk of symptomatic congenital infection among those that were infected. And there was an increase in some of the side effects that we were looking for among women who actually received hyperimmune globulin. So unfortunately, we found that it did not benefit women or their fetuses or infants, and potentially had increased side effects.
Issue applied in Ecuador. This type of study has not yet been carried out in Ecuador. Therefore, it is known for sure what effectiveness hyperimmune globulin has. According to studies carried out years ago, there is no significance of improvement for newborn babies when using this treatment in pregnant women.
Often exposed to young kids who can spread it to them, and also because CMV can cross the placenta. So 1 in 100 babies in the US are born with CMV, and of those, 1 in 5 is going to have symptoms or sequelae. And the disease can range in severity from mild to fatal, but possible signs of congenital CMV infection at birth include premature birth with low birth weight, hepatosplenomegaly, respiratory distress, microcephaly and seizures, and a petechial or purpuric rash. So that's all stuff you might see at birth. And then
Finally, the conclusion. Treatment with hyperimmune globulin didn't significantly modify the course of primary cytomegalovirus infection during pregnancy. Thanks for watching my video. Please like and comment. Thank you very much.